Now in Better Health we find out about advanced care planning.
Well, I'm David Tulloch. I'm the Chief Medical Officer for Southern District Health Board, which is very much a strategic view for the whole of the health system in Southern. In addition, I chair an integration team for the South Island, so I have a regional perspective on many things, one of which is advanced care planning. And I think it's important to have the thought and the philosophy of what advanced care planning is. It is not decisions that will be imposed upon anybody, but these are the thought processes that we think people should have when they are well to determine what they themselves consider are the ceilings of care that they would want put in place nearer the end of their life. And it is a free choice. Some people will opt from cultural, religious, whatever views that everything should be done, and others for the same views but with different philosophies may well say that, well, actually I don't want that. That doesn't fit in with how I perceive my end of life care. And so the advanced care planning awareness campaign that's being started is really important to start getting people to think away from, if you like, a episodic illness event, but into the whole system of wellness during their life.
They say life's a gamble, that the only things you can be sure of are death and taxes. But we still spend a lot of time planning, even for everyday things, like what to have for dinner.
Pork bones watercress.
Like a strawberry dessert with it's got soggy biscuits. It sounds really bad.
Well, we thought we'd start with salmon fillets.
Yeah, we were just going over there to go and look at the pork actually.
We even planned for the impossible, like what we'd do if we won a fortune.
How much have I won?
Oh, shucks.
White car.
Yep, white car.
Go back home to go to see my family in Lebanon.
Buy a nice little house with a big garden, I think.
The first thing I'd do, I think, is probably replace the old dunger.
I'd get my pilot's licence, I'd fly.
Sure, somebody has to win, but it's unlikely to be you or me.
Powerball, 1 in 30 million. I think normal lotto, 1 in 7 million, I'm not sure.
But he puts them in his pocket and then they go in the wash.
The strange thing is we don't spend any time planning for the one thing that's definitely going to happen.
It's hard to think about. You don't know how you're going to die, when you're going to die.
No, I don't think about it a lot, but I do think about it occasionally.
We might not know how or when, but we're all going to die. And we need to plan for it.
If I was dying, what would be important to me?
I would make sure that my closest people were okay if I'm not there.
Yeah, played my last game of league.
I don't know. I think I would just hang out more with my family.
If I was dying, what would be important to me? Living.
If we were told we're going to die tomorrow, there would be no regrets.
An advanced care plan can help us live our life to the fullest, especially during the more difficult times.
I want to know that the medical team in particular are aware of what I want and can actually help me through what's going to be a very difficult time.
It was very frustrating for me when my mother became inaudible, without any plans. It caused quite a bit of friction between my sisters and I.
I would like my last memory to be something that I've really enjoyed throughout my life, and that is sailing. Just go out with the breeze, the outgoing tide. That's something that I would really like to remember.
I'm on a working party that's just looking at, as I said, those roles and responsibilities. And we're really at a point of, it's not about, where's the paperwork, where's the bit of paper, the plan, we've talked about these plans. We're linking in with a lot of work that's being done nationally. And there's an advanced care planning cooperative. And a lot of that has been in different pockets throughout the country, different ways of activity. Canterbury have got a big project going at the moment in their DHB. Where we're at is linking in with the work that's going on. And one of the big things that's coming up next month on the 16th of April is a Conversations That Count Day. And that is about, just as I've talked about, those key things around have we thought about it? Who have we talked to about it? Who do we want to talk to about it? There are things that you could, think about. It's just as I've said, if we had a little bit of a checklist in mind, we're always told we should have health insurance or fire insurance or life insurance or, but this is another one of those processes that a lot of things that the checklist would be, have I thought about what's important to me? Who have I talked to about that? How have I shared that? And then things like, the legal side of things, getting, it's not about, I've worked in palliative care for over 20 years and, it's taken me only to, in the last few years to go, I've got my will organised and I've got my enduring power of attorney organised, and those are things that make stressful times very, much less stressful for our families and the people around us.
To the patient themselves or to the individual themselves, there has been thought when they are well, rather than at the last minute when everything's a crisis and a drama. And also it allows the families who may be left behind in that situation, knowing that they've had the discussion and the individual made clear, sensible decisions in a period of wellness and not having things forced upon them or we'd better try something just in case.
From a DHB perspective, we're only part of the picture. This is it's not the hospital team's job, it's not the GP's job, it's not the specialist oncologist or respiratory physician's job or the nurse or the doctor. This is about having the opportunity at different points when you connect with the health system to be understood. And so it's also really important that from a DHB perspective, we know what our responsibility is around communicating back to primary health. So the Conversations That Count Day that we're going to do a little bit of work here with the display in Dunedin Hospital, Southland Hospital will also have so the posters, the postcards and a team down there just explaining to the public and staff what that's about. And so it's at other areas, and like the hospice is also going to be involved in that as well. One of the hospice team is on our working group here with the DHB.
I'm not planning my death, I'm planning my life.